Welcome to Clicks and Coffee. Today I'm honored to introduce Reg Hislop III, a distinguished executive with over 3 decades of experience in the healthcare and nonprofit sectors. As the co-founder and managing partner of H2 Healthcare, a national consulting practice, Reg has been instrumental in guiding health policies, economics, and market research for numerous organizations. His leadership tenure includes serving as president and CEO for the Village at Manor Park and Oakwood Lutheran Senior Ministries, where he spearheaded significant developments such as state-of-the-art skilled nursing facilities and Medicare hospice services. A prolific author and speaker, Reg has contributed to over 150 articles and research papers, along with publishing 3 books. I'm eager to delve into his extensive experience, his insights on healthcare consulting, and his vision for the future of healthcare. Reg, thanks for being here.
My pleasure.
So that was quite the intro. We were speaking offline, that you basically have seen it all in the senior care.
Close,
so,
yeah, pretty close.
This will be a pretty cool podcast. So one of the questions that I love to ask is, because senior care is always it's an industry where people really go for it because they care. And so I kind of wanted to see, what is your story and how did you get involved into senior care?
Sure. It actually started by accident a long time ago. I was doing some work for a company back in the mid 80s and in graduate school at the time. And the company was involved in software development. And I was doing work on behalf of them in terms of some client development and some rollout of some different kinds of software platforms when the company was bought. And I ended up being out of work, a relatively young guy in my mid-20s. And this was, kind of late spring. And I went with my dad to a luncheon that my dad was involved in. Dad said, "You got nothing to do. Put a suit on. Let's go to lunch. I'll at least buy you lunch." So I did. And at the table that I sat at was a gentleman who was running back then the precursor company to the Village at Manor Park, which I ran for almost 25 years. So I met him and we started talking, and he asked me what I was doing. And long story short, I told him, well, I was out of work, but I was going to go back to school and do a few other things and so on. And he said, "Well, since you've got some free time, how would you like to come and kind of work for us? We just bought this actuarial consulting firm, but we don't know anything about that. And your dad says you have some experience with mathematical modeling and some other stuff. Maybe you'd like to help us," and so on. So I said, sure, gives me something to do. I was about to get married at the time, coming up. And so I started, and lo and behold, he liked me, I liked him. I got married. I never left. I ended up, working with that company, bought another company with them, started their home health program, their medical equipment company, and ultimately became the chief operating officer. And then he suddenly passed one day at his vacation home in Florida, and I ended up becoming the CEO and was there for almost 25 years, the first 25 years or so of my career. And since then, I've never been really directly outside of senior care or healthcare. I've been either consulting in the industry or running companies or doing mergers and acquisitions and investment work and so on. So I've kind of run a lot of the full gamut. I tell people about the only thing in healthcare I've not done, really on the provider side, is I've not yet run a hospital. I financed some, and I was part of a team that did some merger work on some, but short of that, I've pretty much crossed most paths with most things, including, the home health, the hospice, the community-based services side, the medical clinics, dentistry, pharmacies, all of those things I've had experience with. So, when you say I've seen a lot, yeah, I haven't seen it all, but I've come pretty close to seeing most of it.
That's pretty impressive. And so And so then you founded H2 Healthcare. Can you tell us a little bit about, I would say your specialty with this consulting firm, because we're talking a little bit offline of you doing all the fun stuff and help people with all the fun stuff.
Yeah, it was funny because I had a business in partnership with Grubb and Ellis, and my wife, who also works in the industry and did for a lot of years as a director of nursing and a nurse executive, left that side of the industry and started working for law firms. So she was doing compliance work and litigation support for large healthcare law firms. When my business got rolled up in the Grubb and Ellis bankruptcy, she was kind of getting burned out in the law firm business, mostly because there's so much emphasis on billing in the law firms, right? So every so many minutes or every so many encounters are supposed to be billable. And while she was very productive from a billable perspective, she was getting a little burned out and said, you know what? I think I would rather do this on my own than continue to work for the law firms, because I can help more clients. I don't have a problem giving away some time. I know a lot of these folks don't have the money to pay what her billable rate was, and recognize that her billable rate from a law firm was marked up significantly, much more than what she would actually make, right? So she said, I think I can do the same thing and yet be able to help my client base more. And I said, well, tell you what, I've got some legacy clients that are not part of my non-compete. Why don't we combine forces and then we'll form a company? So we formed H2 Healthcare, and we decided that we were going to focus on three things. One of which was compliance work, clinical compliance work, which is her expertise. The second would be risk management and sort of the financial end of the compliance, the billing, the Medicare stuff, and so on. And the third part would be helping our clients strategically by being a resource for them from the standpoint of economics and policy and what was going on, being able to help them with executive development, corporate development if they needed it, and so forth, which was a lot of my area of work. So we started that, and since then we've done nothing but grow, and we grow organically. We've grown by word of mouth and referral. We really don't and haven't needed to market much, mostly because I guess we're good at what we do and our clients like us. So they keep, we've got clients all over the country now. We keep getting folks who show up and say, hey, I heard from so-and-so and so-and-so. Are you willing to help us with this? Are you willing to help us with that? And it's been fortunate because my wife's expertise, as we were talking offline, is really on the clinical compliance side and the forensic work. And she's built a reputation, and deservedly so, as being one of the foremost clinical compliance, if not the foremost clinical compliance expert in the country, in senior living and post-acute care. So she's doing work with national insurance companies and national law firms and so on, working in these litigation matters and these compliance matters, and has become a real kind of a rock star in the industry, which has been interesting to watch evolve. She never wanted to, but she's written a couple of books, published a couple of books on compliance stuff, and has become a real go-to resource for the industry, which is fun. She likes it, and she's good at it.
That's that's great, and that's we kind of need that. And so based on what we just discussed, what would you say is the most common mistake of people getting caught in compliance, or like not doing what they're supposed to do?
I hate to say it this way, because it will come off as more pejorative than I mean it to be. But I think the biggest mistake I see people make is ignorance. They just don't know enough, and they don't ask. There's so much complexity now that they don't read, they don't stay as informed, or they get misinformation and kind of get the wrong kind of information from the wrong sources. And sort of misunderstand what is really going on and kind of what the core of compliance really is and what some of the major risk areas are and how those roll out. And it's not because they're intentionally wanting to either give bad care. Most of them don't, and intentionally wanting to inappropriately bill or other things like that. They don't want to. They just don't know any better. And trying to get them to understand that unfortunately, because things have gotten more and more complex, they were complex pre-COVID, but have gotten more so post-COVID, that you really got to stay on your A game. You can't stop learning. I mean, no matter how long you've been doing it, like me, right? Doing it almost forever, half of my lifetime almost, it seems like. The volume that I read daily and the amount of work that I do just to stay current, and then the amount of work that my wife and I do collectively to stay current, would astonish most people. And in theory, we're supposedly experts, right? And the definition of the expert is the guy who reads one book more, sort of than the person before. So we do a lot of that work, and I write a ton. I've got a website and a blog that's out there that people are hislop3.com can go out, and everything on there is free. There's not a single thing on there that anybody has to pay for. And there's stuff up almost, 2-3 times a week just on the things that people should be, I'm hoping, paying attention to and so forth. And then there's tools and downloads that we put out there and so forth. So like just in the last 10 days, I published a 3-part series on home health and hospice fraud. So for the folks who, again, this is one of the things, it's not tough to read, but because we do this work and I find people continuously caught in these issues or running into problems, it's like, go read that stuff. Just spend a half an hour and go read it. It's free. And maybe it'll give you some of the insights to not get into trouble, to kind of stay away or to mitigate the risk. Because, frankly, it's not the issue of what happens if you get caught, even if you weren't intending to do anything wrong. It's the cost of getting out of the problem that tends to be fairly expensive, especially billing compliance, and or then clinical compliance, which can turn into, extensive survey problems and, God forbid, in cases sometimes litigation. So,
which is what you don't want to get into.
Right. Ounce of prevention stuff, right? The prevention end is much cheaper than the mitigation end.
And that's what you work on. And basically, right. As long as we follow your advice, people
we hope, we'll help folks fix it too. But ideally, we would just as soon, see more folks spend more time on the front end and on the back end.
Yeah, and maybe that's what you should start now as like a new venture of like the compliance training of a monthly subscription where people kind of have to do that, at least in the big groups, to ensure proper compliance.
Yeah, it is something that we're looking at, and I mentioned to you that we're working on this virtual system with some other folks where we can offer them a free resource on a lot of things, and then add to it a smaller fee kind of subscription service where they would be able then to have us work with them directly on some of the key risk areas and compliance things that they ought to be doing, but need to, from a compliance perspective, from a risk management perspective, need to be doing third-party kind of stuff, engaging third-party experts, and that's what we represent, is that third-party resource. But on a virtual basis, it's much, much cheaper than having us, which we would do, and we used to do a lot of pre-COVID, was go on site. But that's far more expensive. And today we're able to do a lot of things virtually. We can have folks, we do stuff on behalf of folks for, like virtual billing audits, looking at their Medicare billing compliance, and going through claims and doing analysis, and then giving them feedback on that and doing education on that. And that's much cheaper than us going on site and going through chart after chart and having, our team go and you paying us per hour and then paying us to travel and all that kind of stuff. We don't have to do that anymore. We can do it at a much more cost-effective point, and then give them the end results and the tools to stay compliant going forward.
No, that's great. And then, so we know also in the senior living that we're getting more and more, people in age to go to retirement home or needed care, and so there is that. People calling that the silver tsunami, and then we know that also Gen X are also coming of age. We see a technology. How do you, I would say, on your side of things in the business, how do you anticipate, I would say, the next 5 years in the industry?
Well, I think, that, so if you kind of look at you sort of look at some of the major trends and headwinds that are out there. One of the number one challenges is going to be a consistent growth in demand because of an aging population that is aging and not in necessarily a healthy way, right? So we're seeing seniors coming in, boomers and so forth, coming of age into retirement age and a little bit later, but they have a host of chronic health problems. So, we're dealing with obesity, we're dealing with diabetes, we're dealing with various underlying metabolic challenges and so forth that are part of this aging, meaning they're not just coming of age, but they're coming of age and needing more help. When we see that, we're also looking at then at the same time a challenge in terms of having enough trained staff to care for these folks. So we've got this growing gap of more people needing care, and yet a shortage, if you will, and a mounting one, of caregivers to care for these folks. Now there's some opportunities out there, and I've been doing some work with a couple of gentlemen, for example, from Israel that have developed and are working on refining, some artificial intelligence, some AI applications in care management for seniors. Their approach is to be interventionist early on to try to stave off deterioration and other risk factors, hospitalization, and so on. And the stuff they're doing is cool. So there's AI applications out there, no question about that. And I think we have the ability to utilize more technology to advance more cost-effective, more efficient care, being able to manage a riskier demographic and aged population, but we're still going to have issues with regard to being able to have enough caregivers, enough care outlets to support the aging population. We're developing a pretty good sized gap right now between demand for senior housing, and it's been nice for existing providers to see their occupancies go up, but because of the cost of development and the cost of capital, there's not enough new development to keep up with some of the future demands. So there's some shortages, some shortage potential out there. And some of it's also, trending on the side of, are we getting to the point where there's not going to be enough access to cost-effective care because it's so expensive to develop new outlets and staff them and so on. And yet, good study done by Harvard and Nick, and it's on my blog, about the gap between affordable housing and affordable care and where people's, retirees, their actual economic capacity actually is. Gosh, it can cost $8,000 to $10,000 in most markets for a month of assisted living. And, I'm not sure how many people
Can do that. Yeah.
sustain that for very long if they need that level of care.
Yeah, no, for sure. No, and for sure, technology is going to also be a big part, and that's going to probably help with also affordability. And actually, I was discussing with another guest of image recognition, pattern and image recognition, where you would have cameras monitoring, I would say, people and helping the nurses or helping the staff checking on people and doing it in a more effective way, because a lot of time, you cannot have 10 people, watching the residents at all time. And so with having technology such as AI and machine learning and all these things, where we can say, Alexander, oh, let's check on Alexander because we see that, he has been sleeping for a little too long, or he's not eating enough, or things like that. And there are already companies working in different industries with image recognition. And I'm really looking forward to seeing what people are going to come out with that will help, I would say, improve level of care and efficiency, and then reducing the amount, I would say, reducing the cost of the monthly living as well.
Right. I think,
that's the biggest issue.
Yeah. And I I'm a big fan of again, some of the applications I've seen and some of the folks I've worked with that are doing strong work on what I commonly call risk segmentation. Because again, we know that, that part of being efficient and delivering high quality care is being able to identify who's really at risk in a population versus the entire population. So if we can do that and say, like you were saying, through monitoring or advanced engagement or advanced decision making and so on, where we can say, out of this population of 10 folks, there's the one or two that we need to be spending the most amount of our time and energy with, as opposed to the other 8. So, with short staff, or I shouldn't say short staff, but with less staff resources, that makes them more cost effective, right?
Yep.
And I think that's an interesting application. I'm looking forward to seeing how that advances.
Yeah, no, for sure, me too. I'm sorry?
Or continues to advance, how it advances and continues to advance.
And I'm already seeing some companies, I don't recall the name right now, but I already saw some companies that do video analytics specifically for senior care.
Mm-hmm.
So for sure that we're gonna see. So yeah, you were also mentioning about COVID, and I know that's a topic I most of the time talk about, because it's really a pre-COVID and a post-COVID. And so how do you see the industry evolved after COVID, and what are the things that in your opinion are a little too extreme, and some things that came out of it that were actually good that now we're implementing?
So I think, on the good side, which is always an important sort of an important transition point or inflection point, is the realization that good primary sort of time-tested and time-honored infection control always makes the most amount of sense, regardless of what, whether it's influenza, whether it's norovirus, whether or not in this case it's COVID and so forth, that the industry had gone through kind of this period prior to COVID of talking about infection control as more or less an activity and a lot of paper compliance, as opposed to really working through some of the core competencies that are necessary to have a really effective infection control, infection control program and so forth. So that heightened awareness, I think, has been a good thing. I think the unfortunate part was we over-evaluated the risk and, placed too much emphasis on certain things as being, sort of a savior that turned out not to be. So forced vaccination policies, which de-aggregated a number of healthcare workers, from the industry, caused early retirements and a variety of things, when we already had mounting staff shortages. We didn't need to lose anybody for not a particular reason. And it turns out that the vaccination really didn't do anything from the standpoint of mitigating spread or mitigating infection. It may mitigate risk to a certain extent of advanced illness, but the real issue around were we going to keep people from getting COVID via vaccination didn't materialize. And the result of that was, and it's coming out now more and more, that that was probably already known that the vaccine wasn't effective in risk prevention at that level. So we probably should have done things a little bit more even-handed and work through a much more nuanced decision-making process that I think would have been less upsetting and less interventionist, and allow things to sort of transgress and transform, more naturally. We probably would have kept more staff engaged and had, less other side effects related to some of the social issues. I saw too many husbands and wives, in circumstances where they were segregated for extended periods of time after they've been married for 50 some odd years. And too many horror stories of people just dying alone, because we weren't letting family members together. And I find that to be I found that to be a bit draconian, for a country where the hallmark is supposed to be informed consent. It wasn't supposed to be, complete, utter, elimination of any risk or isolation. That was unfortunate.
Yeah. And so, reflecting on your career, what advice would you offer to emerging leaders aiming to make a significant impact in the senior living industry?
Sure. Well, start out with the first thing we were talking about, right? When we were talking about where, sort of where folks can make improvements and some of the things I see as risk areas. Study like crazy. Never stop learning. And it's not about going to conferences, that's great if you can, but it's read broadly, think broadly, study broadly, look at other industries, look at what's going on overall, kind of in a macro perspective. Don't just fixate on your industry, but if you can fixate on a broader kind of paradigm, you'll be more successful in understanding what's going on even in your own business or your own world with relevant things that have happened in other industries and other countries. It gives you a broader perspective. Focus on physical and mental health. I've watched way too many leaders burn out. They get angry, they get bitter. They end up, in circumstances where, the divorce rate and the alcoholism and all the other stuff that creeps in becomes sort of part of the daily milieu. From a guy who's 40 years and still married, and I work with my wife daily, right? We're business partners, and I've got good health, knock on wood. Gen X, I'm sure, is part of it, but I'm much older than younger, and I maintain excellent health. I don't have I don't take any medications. I don't have any other health issues, and that's principally because I've practiced what I've preached all these years, which is moderation. Stay healthy, take time, stay mentally sharp, get active, be active. It's not how long you work, it's how effective you work. Time is not your friend. Being effective is your friend. So study hard,
The only thing we should not do in moderation is learning.
Yes, learning. Never stop learning. Yeah. Keep that inquisitive mind. Keep that mind open.
Curious.
Yep. Curiosity is a good thing. Absolutely.
And then read your articles.
Well, ask questions or get online or write one of your own. And if it's any good and it's helpful and it's not biased, I'll post it.
Yeah, but I'm saying also, since you're so involved and so caring, because what I heard from you a lot is that it was things are too expensive, and like trying to kind of settle pricing or settle things, right, so everybody can work and function normally. So with all the stuff that you're publishing and helping people, I think a lot of I would say aspiring leaders can go on your blog and read your articles and learn more about.
Well, I think the other thing too, that's part of that secret, right? When you say what can people do, give back. Don't just think about what you're doing for yourself. Give back, right? So as you have the opportunity to, what's the expression? Pay it forward. Give back. wealth comes two ways, one of which we can't take with us or spend beyond a particular point. So sometimes the most amount of wealth somebody has is what they've been able to do for others, not just what they've been able to accumulate for themselves. Stuff won't matter at some point, right?
Yep.
It's just irrelevant.
All going to the same place.
Correct. Yep.
No, Reg, it was a true pleasure having you on the podcast. I really wish you all the best for H2 Healthcare, and that all the problems that you have to resolve are being resolved swiftly. So I'll put in the description, ways to contact you directly by phone. I know you have a couple of websites, so we'll make sure to list that, and the blog as well, because learning, this is how you advance, and you said that. And really looking forward to seeing the industry getting better and better thanks to people like you.
Me too. Thank you so much. Appreciate the time.